Varicose veins are a common condition that affects millions of people worldwide. They occur when the veins, typically in the legs, become enlarged and twisted, resulting from blood pooling due to weak or damaged vein valves. While often thought of as a cosmetic issue, varicose veins can be an indicator of more serious underlying health concerns, such as chronic venous insufficiency, and may cause discomfort or even lead to complications, like blood clots or ulcers if left untreated. If you're concerned about varicose veins, catching the early warning signs is crucial. Here are the 5 early warning signs that you should be aware of to prevent them from worsening, and to take the necessary steps for treatment and prevention. 1. Visible spider veins or vein discoloration. One of the earliest signs that varicose veins may develop is the appearance of spider veins. These small, thin veins lie close to the surface of the skin and typically form a web-like pattern, often red, blue, or purple in color. While spider veins themselves are generally harmless, they are a sign that your blood circulation may not be optimal. Spider veins can eventually develop into varicose veins, particularly if the underlying issues like venous insufficiency worsen. If you notice these changes in your skin, especially around the legs or ankles, it might be time to assess your vein health more closely. In some cases, you may also notice general skin discoloration around the affected veins. The skin might take on a darker or redder hue, a condition known as stasis dermatitis, which occurs when blood pools in the veins and leads to inflammation. Pay attention to any changes in the skin's color or texture, as this can be a subtle early sign of vein problems. 2. Leg swelling. Swelling in the legs, ankles, or feet is another early sign that your veins may not be functioning properly. This swelling often occurs because blood is not circulating back to the heart as efficiently as it should, as blood pools in the lower extremities due to weakened vein valves. Fluid can leak from the veins into surrounding tissues, causing noticeable swelling. Leg swelling related to varicose veins tends to worsen after long periods of standing or sitting and may improve when you elevate your legs. Swelling can also be accompanied by a feeling of heaviness or tightness in the legs. If you frequently notice swollen legs, especially at the end of the day, this could be an indication that your veins are struggling to return blood to the heart effectively. While swelling can be caused by many different factors, recurring swelling combined with visible veins should be taken seriously, as it may be a precursor to varicose veins. 3. Aching, throbbing, or cramping in the legs. Varicose veins often lead to a sensation of aching, throbbing, or cramping in the legs, especially after prolonged periods of activity or standing. This discomfort is typically due to increased pressure within the veins, causing inflammation and irritation in the surrounding tissues. The pain can vary from mild to severe, and it often gets worse as the day progresses. You may also experience a feeling of heaviness or tiredness in your legs, particularly at the end of the day. This heaviness is often due to poor circulation, as the veins struggle to pump blood back up to the heart. In some cases, people with early-stage varicose veins report feeling a constant, dull ache in their legs, which may be relieved by elevating the legs or wearing compression stockings. If you're noticing persistent leg discomfort, especially along with visible veins or swelling, it's essential to seek advice from a healthcare professional to prevent the condition from progressing. 4. Itching or irritated skin around the veins. Another lesser-known early sign of varicose veins is itching or irritated skin, particularly in areas around the visible veins. This itching, known as venous eczema, occurs because the blood that pools in the veins can lead to inflammation in the surrounding skin tissues. When blood circulation is poor, fluid can leak into the skin and cause irritation. This may present as dry, flaky skin or persistent itching. Sometimes, people with early-stage varicose veins mistake this symptom for simple, dry skin or a mild rash, but when combined with other signs like visible veins or swelling, it could indicate developing varicose veins. Chronic itching can also lead to further skin issues like skin thickening, ulcers, or even infection if scratched excessively. Paying attention to skin irritation and treating it early can prevent these more severe outcomes. 5. Restless legs or tingling sensations. A common but often overlooked symptom of developing varicose Veins is the sensation of restlessness or tingling in the legs, especially at night or after sitting for extended periods. This feeling, often described as a pins and needles sensation, is linked to poor circulation in the legs caused by faulty veins. Restless leg syndrome is a condition that makes you feel an uncontrollable urge to move your legs, usually because of uncomfortable sensations. Although RLS is not exclusive to people with varicose veins, it can be triggered by the poor blood flow associated with venous issues. You might feel the need to move your legs to relieve the uncomfortable sensation, which can disturb your sleep or make it hard to relax. Tingling or restlessness is often one of the early signs of vein problems and can be a precursor to more obvious symptoms like swelling, visible veins, or aching. If you're experiencing these sensations in combination with other symptoms, it may be time to take steps to support your vein health.